In this video, I'm going to talk about administering blood products. So during your NCLEX exam, if you know this content, and I'm going to discuss about 17 points. So once you know all of the 17 points, for sure you will be able to crack any answer when you see blood product questions. So let's discuss about it. So first thing first, the first point is that you must get a consent from the patient. The nurse is going to be the witness, the client signing the consent document and verify competency. So first thing first, you must get the consent. That's the first step when before you are going to administer blood products. So you must get the consent from the patient, right? That's the first step. The second point is that you need 18 to 20 gauze needle. You need about 18 to 20 gauze needle. And you also need a blood tubing with filter. And remember that you need also 0.9% sodium chloride, normal saline. That is only goes with the blood products, nothing else. So if they give you lactate ringer or any other D5 solution, do not select that. Only the thing you need to select is 0.9% sodium chloride. That only goes with the blood. And you need 18 to 20 gauze of needle, right? The third point is that two nurses must verify name and date of birth or identification band. The single nurse cannot verify this information. You always need two nurses, right? Name and number on the client identification band with the name and the number on the unit of blood. You must verify with the two nurses. If you see single nurses is asking patient date of birth, that answer is going to be wrong because you must need two nurses to verify. Point number 4, the correct solution, as I mentioned before, to use flush the tubing when administering a blood product is only 0.9% sodium chloride. Normal saline is the only solution used to flush the tubing during a blood transfusion. So always remember that. So the next point is number 5. If the patient is religious and has the objection to blood transfusion, so what nurse is going to do? So the answer you are going to select is the nurse is going to speak to the doctor about the possibility of a non-blood volume expander. Something else alternative instead of blood transfusion. Non-blood volume expander, right? Number 6, another scenario. If the child is about to receive blood product, but the family is practicing Jehovah's Witness, so what action by the nurse is best? In this situation, you are going to ask the child parent if they are opposed to a blood transfusion. If the parents are agreed, then you continue with the transfusion. So always ask the parent if they agreed or disagreed. Point number 7. If the nurse is about to begin the blood transfusion, but when check oral temperature is 100.6, what nurse is going to do? So the first step is going to be the nurse is going to delay the hanging blood and notify the physician. That's the first step you're going to do. And it's up to the doctor if he still wants to continue with the blood product or not. But you need to write a progress note that doctor wants to continue even after 100.6 oral temperature. So you always delay hanging blood product and notify the physician when you find something new. Point number 8, just before the beginning of transfusion, what should the nurse do? So nurse should always check the vital signs. You must check the vital signs before you start transfusion. Change in vital signs during the transfusion from the baseline may indicate that the transfusion reaction is occurring. That's why the nurse assess vital signs before the procedure and again after 15 minutes. So you must remember that. You check the vital signs before and 15 minutes after the transfusion started. Next point is point number 9. When the blood transfuser is on, the nurse must stay with the client during the first 15 minutes of the infusion. The reason is within 15 minutes you will be able to tell if the patient is having any kind of reaction. So always select your answer as stay with the client during the first 15 minutes of the infusion. Okay. Imagine 6 o'clock I hung the blood product and I'm gone home. So 10 o'clock the new nurse came in and she noted that the blood is still running. What's gonna happen next? So what you have to do, what the next nurse is gonna do, she gonna discontinue the transfusion. The reason is a unit of blood should be administered within a 4 hour of period. The nurse should discontinue the transfusion, document the finding and notify the blood bank. Continue the blood will cause injury or sepsis. So you must discontinue the transfusion after 4 hours. If you are still noted the blood is not finished yet. So the answer you are going to select that the blood product must finish within 4 hours. After 4 hours is bad and it will cause sepsis or injury. If the patient complained of chills, chest and back pain and nauseated, the face is flushed and anxious, what nurse needs to do first? So that's mean the patient is having transfusion reaction. So you must stop the transfusion and maintain a patent IV catheter. You must stop the transfusion and maintain a patent IV catheter. So you can run 0.9 sodium chloride. If the patient is get less blood, that's mean it's better for the patient. The less blood, contaminated blood going in is better as you already stopped the infusion. So less is good that you have already stopped the transfusion. Point number 12, another scenario. If the patient is receiving blood transfusion and 45 minutes later, the nurse auscultates the presence of crackle in the lung bases, what's going on? So if the nurse is hearing the crackles in the lung bases, that means the patient is having fluid overload. The patient is having symptom of fluid overload. That means the patient receiving too much blood in fast speed. So you are going to select. So if during your exam, if you see a question, if the patient is having crackles in the lung base, what's nurse gonna do? You're gonna select the patient is experiencing fluid overload. You must finish your blood within 4 hours. The real reason is the blood has a potential for bacterial growth if allowed to infuse longer period of time. So you must finish in less than 4 hours. If you are going to hang another unit of blood transfusion, you must check in with the another registered nurse or LVN depending on the company policy. The unit secretary, phlebotomist and physician assistant, they are not the nurses. So you must check with another nurse before hanging the second unit. Another point, if the nurse hear crackle on chest, auscultation and distended neck vein, what is the nursing initial action? The initial action is going to be that you are going to slow the transfusion. Slow the rate is proper action that nurse is going to take, because that means the patient is having too much of blood in the faster speed, which is causing fluid overload. So that means you have to slow the transfusion if you see crackles on chest, auscultation or distended neck vein. If the patient is having transfusion reaction, the nurse must stop the transfusion. And what thing can you do next? So the nurse is going to run normal saline at a keep vein open rate. This maintains a patent IV access line and aids in monitoring the client intravascular volume. And also the doctor, if he give you any orders, then you can also give that way. So that's why keep the line open. So read question and arrange this in order. During your NCLEX exam, you will get to arrange this in order.